Dr. Heather, and welcome to my discussion on runner's knee versus ITBS. Okay, so as you guys know, it's a very hot topic right now in runners because they're getting those aches and pains and really having trouble figuring out, well, which one do I have? So today I want to really kind of go over that so this way you can figure out which video on my channel is going to make the most sense for you to watch in order to rid yourself of that pain. But first off, if you haven't subscribed, please go ahead and do. And if you are a current subscriber, thank you so much for always watching. And I always try to provide the best content possible for you guys by incorporating some different things that you may not see in traditional physical therapy offices. Okay, so let's get down to it. Let's really kind of have a better understanding of our IT band area and our runner's knee. Okay, so just so you guys know, there's a lot of new information out there in terms of new studies done that really emphasize what I already teach all my patients, whether it's virtual or in person. So we want to take a look at something here. With the help of my friend, Mr. Super Skeleton, we want to kind of have a better understanding that the fact of the matter is when we look at our knees and we address knee pain, a lot of the times the knee is the result of a force or a load being put on from either the hip or what's going on at the ankle, okay? So hopefully that makes sense. So what I'm saying is that even though you might be complaining about pain around the knee, inside the knee, or off to the side of the knee, a lot of times that's in conjunction with something else that's going on above and below the joint. Should make sense, correct? Okay, so with that understanding, now granted, yes, there are some true knee injuries like ACL, MCL injuries, but we're not talking about those today. We're kind of more distinguishing between this kind of understanding of what's a runner's knee versus having my IT band being the issue, the syndrome. So we want to start really figuring out why those two types of knee injuries would happen and why they would occur. So let's distinguish between the two first, okay? So right off the bat, we know that our IT band starts all the way up here, pretty much at the greater trochanter, okay, of the hip. So the bit of tissue that attaches from the top part of the pelvis up to the greater trochanter is known as your TFL. And it's very rare to have an injury all the way up here at the TFL. A lot of times we find out that we have more tender points right around that ball and socket area, but more so kind of coming down mid-calf, down all the way to the outside where the fibular head is off the lower leg. So right there, if we have that understanding, that's our IT band. Then we also know a lot of times it's because of friction between the femur and the tibia. And the tibia is where our shin bone is, okay? And obviously our thigh is that femur, okay? So if we know that the IT band is that friction that's being caused between the femur and the tibia because of usually some rotational movement, okay? Then we have a better sense of understanding that that's why that tissue becomes irritated and then starts to create some knee pain. Now, when we look at runner's knee, a lot of times with runner's knee, it's also known as patellafemoral tracking or chondromalacia. So that's where we look at what's going on here in terms of that patella. So now we know the patella is a free-floating bone. So if we were to take it off, it's free-floating, we could just take it right out. A lot of times it's what's happening with the tendon or tendons that are around that area. So this is where a lot of times we look at the muscular development of our thigh and we look at that relationship between our outer thigh and our inner thigh. To give you a better explanation, even going a little deeper, our quad is made up of 4 muscles, okay? Quad in Latin means 4, so obviously we have 4 muscles to our quad. Right here, where we see this tendon off my friend, this is for the rectus femoris muscle. That's your main quadricep muscle. So if you go ahead and you sit in a leg extension machine, majority of the time you're just working your rectus femoris. But what we want to do is we want to actually address the other 3 muscles, especially when it comes to runner's knee. We want to look at the other 3. So if we took this right off, okay, and we took we took our rectus femoris right out of the picture. We'll see the other 3 there. And I always use this as the explanation. If I take my fingers, I place them here, I can go ahead and then distinguish between what's known as the vastus lateralis, meaning all the way on the outside, the intermediate, which is in the middle, and then the medialis, which is here. So when we're dealing with runner's knee, a lot of times our patella is being pulled or shifted a little bit too much to the outside, leaving the inside of the knee a little bit more vulnerable to those forces in terms of the load, the force that you're feeling, what's going on either, like I said, at the foot ankle in terms of how that tibia is rotating on that femur, or how that femur is moving and rotating here at the hip and then putting torsion down more towards the knee. So right off the bat, when we deal with runner's knee, we do want to address more of our adductors and trying to strengthen a lot more in terms of the VMO. And with our IT band, we want to go ahead, make sure we're breaking down the tissue on the outside, but again, also making sure that our inner thigh is strong. But at the same token, we also want to address our glute firing patterns as well, because those become hugely important in terms of making sure that we're not having too much what we call external rotation at the hip, meaning if our hip starts to externally a little bit more, we're going to put tension on that IT band, which can also irritate that IT band. So that's why in the IT band video, you're going to see that I do address working the soft tissue to the piriformis muscle. And again, we don't want to necessarily just pull that hip out to the side. We do want to create some stabilization in that joint as well, especially if we don't have a good relationship between inner thigh and outer thigh musculature. So guys, like I said, that starts to get into the anatomy and the functionality on how to really distinguish between what's going on with a true iliotibial band syndrome versus an actual patellafemoral tracking issue known as, runner's knee, as they quote unquote call it. The other kind of giveaway too is with the runner's knee, if you're noticing you're having a lot more pain or discomfort, especially walking up and down stairs, sitting for long periods of time, that's also a classic sign that it's more of a runner's knee, versus noticing that with increased activity while running, all of a sudden that knee pain is coming on because that IT band is now getting a lot more tension. It's starting to become more irritated. So like I said, guys, I go into more detail about the more specifics that you can do to prevent runner's knee and how to kind of give you more tricks and tips and exercises in the runner's knee video, and the same with the ITBS video regarding your iliotibial band. Again, these are all just kind of helpful tips. If you have something more specific that you think is going on with you, or you're prone to more injuries, or you're currently experiencing more than just that injury, do kind of reach out. Please leave a comment down below. I'm happy to talk to you further about what's really going on. As I've mentioned before in some other videos, all my subscribers do get a free video consult with me, so do take advantage of that. I'm here to help you guys feel better about returning to your sport, getting back to activity, and really just feeling like you're making the right strides in your own injury prevention. So like I said, guys, this was just a simple kind of breakdown, kind of distinguishing between more of that iliotibial band syndrome versus that patellafemoral tracking issue, understanding what's going on at the knee, and how we want to look at really the biomechanics and that kinematic chain all the way up and all the way down, because the knee is really taking more of the load due to whatever's going on above or below the joint. So we do want to address that. So if you have more questions, please do drop some comments down below. As always, if you found some of this information helpful, give it a like. And if you haven't subscribed, please go ahead and do watch those other 2 videos, as they will kind of give you some more helpful tips and hints on how to really kind of correct those problems. As always, guys, this is Dr. Heather. Have a great day.